let's look at a couple of examples of surveillance systems for health that already exist, starting with this system called Supreme from Quebec, Canada, for heat, cold, and flooding. So they are specifically exposed to these kind of climate events, and they are they have designed their surveillance system for those hazards. So here they're looking at health indicators, hazard indicators, context indicators, and warnings they would generate out of the system. So in heat, there is a dynamic and parameterizable graph presenting by health region the temperatures, number of events per day, and average for the displayed period of the following indicators: daily deaths, daily hospitalizations, daily admissions to emergency rooms, daily ambulance transports, info calls, so oppressive heat type of calls, info health calls, heat-related illnesses. The period of interest can be parameterized within the limits of data availability. So a map displays in real time steps in the intervention plan implemented by health regions during a heat episode. The hazard indicators, again, region specific, have to be developed locally. The following indicators are presented by weather region. So even within Quebec, there are subdivisions. Maximum and minimum temperature observed in the last 3 days, maximum minimum temperature forecast for the next 3 days. So here is a climate specific information going in. Weighted or weather specific, weighted average of the forecast maximum and minimum temperatures, extreme health thresholds for maximum and minimum temperatures, and so on. So humidity index. So heat is always relevant also in the context of humidity, because it can make the heat very oppressive when humidity is also high. And of course, number of days per year by health region and weather region where the daily maximum and minimum temperatures are simultaneously reached the extreme heat thresholds. Okay. The context indicators include things like parameterizable spatial data presented by dissemination area. So there's mapping involved with spatial density of population suffering from chronic diseases, distribution of the population by age, which is always critical for vulnerability, distribution of people with 65 years of age or older living alone, spatial population density. So this is general population as opposed to population suffering from chronic diseases. Social and maternal deprivation index, air conditioning level estimated by electrical consumption, location of swimming pool, location of cooling centers, location of green spaces, heat islands, so 20-meter resolution, sub-city level, regional, local, neighborhood level location, also green spaces and cool areas at 20-meter resolution. So warnings include extreme heat waves with risk of excess mortality, day of oppressive heat, summer smog, which is always much worse, made much worse by the heat wave. And under cold, there is a dynamic and parameterizable graph that presents by health region the temperatures, number of events per day, the average for the displayed period of the following indicators: daily deaths, all causes, and specific causes. Following indicators are presented by weather region: maximum and minimum temperatures observed in the last 3 days, maximum and minimum temperatures forecasted for the next 3 days. And under context indicators, we have parameterizable spatial data presented by dissemination area, spatial density of people suffering from chronic diseases, and in terms of warnings, we have wind chill, when the combined effect of air temperature and wind velocity could produce frostbite on exposed skin. Okay, so again, under health indicators, we have daily hospitalizations, all causes, daily admissions to emergency, all causes, daily ambulance transports, so info health calls, cardiovascular problems, info health calls on respiratory problems. Period of interest can be parameterized within the limits of data availability. So there is a certain data network that provides data to do many of these things, but data gaps can be identified, and future versions of the network can fill these data limitation gaps, right? Data limitations and gaps. Hazard indicators include number of days per year by health region and by weather region where the minimum temperature was below 20 degrees centigrade, number of days per year by health region and by weather region where minimum temperature was below 30 degrees centigrade. Again, there are context indicators that are similar to what we looked at, but now here include location of temporary lodging in the event of disaster, location of educational institutions which can be used as shelters, location of daycares, location of health services institutions, and location of public low-cost housing. Okay, so the warnings include winter smog, when air quality based on a concentration of tropospheric ozone and fine particulates is forecast as poor for the weather region. Okay. Floods. Dynamic and parameterizable graph presents by health region the temperature, the number of events per day, and the average for the displayed period for these indicators, which are similar to what we have already seen, except it includes now injury, gastrointestinal problems, because floods often bring waterborne diseases, as we know, and info health call for respiratory problems, because a lot of mold and other problems that emerge after floods can also cause exacerbation of respiratory problems. The following indicators is presented. Rainfall forecast for next 24 hours. So if there is a flood and you are getting more rain, you must be aware of it. Torrential rain thresholds, so 50 millimeter or more in less than 24 hours in summer, and 25 millimeters or more in winter. Map representing in relation to the values of the levels or flows of stations for several streams the different flood thresholds by administrative region as established by the appropriate authorities are indicated as normal, surveillance threshold, minor flood, average flood, and major flood. Okay, the indicators, parameterizable spatial, or the context, parameterizable spatial data presented by dissemination area, so spatial density of people suffering, and like what we saw before, age groups, spatial population density, social and material I think I said maternal before, sorry about that. Social and material deprivation index, distribution of landed immigrants. Here we are taking more special care of population groups that are where concentrations of immigrants pose special problems or local neighborhood specific problems. Distribution of people speaking neither English nor French. Remember, Quebec is predominantly French, but English is also spoken, but there are many immigrants from the Middle East, for example, which may not speak either language. And the warnings include major flood. Okay. Finally, health indicators of these include period of interest can be parameterized within the limits of data availability. Hazard indicators include flood-prone areas. The return periods are shown: every 2-year flood, every 20 or every 100-year flood. That gives you a sense of how major the flood is. Obviously, every 2-year flood is not going to be as big as every 20-year flood, which is going to be much smaller than every 100-year flood. And these will of course be updated because climate change is expected to change these return periods. For example, every 20-year flood may come every 5 years, and every 100-year flood may come every 20 years or every 10 years. And of course there is also floodway zones. Context indicators include location of temporary lodging in the event of disaster, location of educational institutions, location of daily care centers, location of health services institutions, and locations of public low-cost housing. Dissemination area, smallest area of Canadian census, average of 700 people with stable boundaries. So urban heat island, flooding, heat, cold can be very, very local. So this kind of resolution is very critical for the monitoring and prediction of these climate sensitive disasters and warnings. Okay, so that's a good example of how environmental monitoring is combined with census data, population data and population distribution, immigration data, language data, and so on, to create very specific local warning systems and contexts and indicators. Those are the critical things that can allow you to issue maps quantified in a probabilistic or quantitative way. Okay.